Well, thank you to Brendan Phair for being here today. And Brendan is the state senatorial candidate for the most western part of the state, so Berkshire County and also a piece of Franklin, Hampshire, and Hampden counties. So it's a large area. So we appreciate you being here today. Thank you again to everyone who attended, both in person and on Zoom, and to everyone who made this event possible. And so I think we have all of the same attendees from last time, but really quickly, I'll just repeat that you should just keep your microphones muted upon entry. And unless you're instructed otherwise, for questions and answers. We will be using live closed captions on Zoom and ASL interpreter services. For your convenience, we are spotlighting the interpreters and the speaker. Time permitting, will provide opportunity for questions and comments at the end of the discussion. And of course, please keep any communications during these conversations cordial and appropriate. So my name is Brianna Zimmerman. I am the systems change advocate here at Stavros Center for Independent Living. I'll be moderating today's event and helping with asking some of the questions. Stavros Center for Independent Living works to empower people with disabilities and provide the necessary tools and services needed to live independently. Since 1974, we've been actively advocating for the civil rights of people with disabilities, regionally, statewide, and nationally. By law, over half of our staff and board of directors at Centers for Independent Living must be people with disabilities. So most of us know about disability here through our personal experiences. Also, please note, we are a nonpartisan organization that will not endorse particular candidates. I'd also like to thank Dignity Alliance Massachusetts, who have provided a bunch of our questions that I've borrowed from, a grassroots advocacy organization that formed during the onset of the pandemic in response to the high rates of death and infection in long-term care facilities. The Alliance is made up of people across the state who are nursing home advocates, disability rights advocates, legal service entities, mental health organizations, and other people as well. First, I'll have Tori Dixon, who is one of our panelists, introduce herself with her name and her position here.
Hi, I'm Tori Dixon, and I'm a peer advocate counselor.
Thanks, Tori. And to Brendan, would you like to introduce yourself quickly?
Sure. My name is Brendan Phair. I'm from Pittsfield. I'm running for state senate representing Berkshire, Hampden, Franklin, and Hampshire. Berkshire, Hampden, Franklin, and Hampshire County. And I work at Taconic High School in Pittsfield, and I work in special ed.
Excellent. Thanks, Brendan. So first, my first question is around your personal experiences. And so most Massachusetts residents know someone who has needed long-term care services or other types of disability services due to issues around aging or disabilities, or experienced it themselves. Has anyone close to you needed these types of disability services? What implications for public policy and regulatory enforcement do you draw from those experiences?
I've had two family members that were in a nursing home. They didn't have physical disabilities, but my maternal grandmother spent her last 7 years in a nursing home in Pittsfield from the time she was 89 years old to 96. So it was a very long time. And from what I gather, her care was pretty good. My mom and I and sister were satisfied with the care that she received. And my father passed away 3 years ago, and he spent his last few months at the same nursing home that my where my grandmother passed. So definitely have experience with being at nursing homes and interacting with the staff and asking questions. And as a family member, you have an expectation that you'll receive an answer to your questions. And but we didn't generally have any issues or problems with. It was Greylock Nursing Home in Pittsfield. We thought they did a great job. But what I draw from my experience with that is certainly there's a great need, not only for nursing homes, but care for people with all different kinds of needs and different ages. The demographics in Western Mass, the population is aging. So it's definitely something that in the future we have to stay on top of.
Yeah, absolutely. Thanks for sharing those experiences. And of course, I know that you work in special education, so I'm sure that you also have some insight there. I'll turn the next question over to Tori Dixon.
So affordable housing is lacking across the state, and even more so for people with disabilities who need accessible housing and accommodations. People with disabilities are more than twice as likely to experience homelessness than non-disabled people. What is your plan to increase the number of affordable and accessible housing units in Massachusetts?
Well, first of all, I do support vouchers and assistance for people who need the housing. As far as increasing the amount of affordable housing, this might seem a little off topic, but one of the issues is landlord-tenant issues. And I've spoken to several people who own property, and they're good people. I know there's bad landlords and there's good ones, but the landlord-tenant rules have gone one-sided towards tenants, and I think landlords, people who own property, are losing the incentive to build or purchase more property to provide more housing. So I think if that was more in line, more people would purchase property to rent out rooms, and existing property owners would be more willing to purchase more property and try to mitigate the effects of the housing shortage that we have here in Massachusetts.
Okay, thank you for your answer. And along with that is the Architectural Access Bill would make it so that the Massachusetts Architectural Board has authority over buildings built before 1991 that have been converted into housing and would require employee-only areas in workplaces to be made accessible. Would you consider supporting this bill? Would you support increasing affordable housing vouchers, home modifications for greater accessibility, increased support for home care and technology, and similar incentives to help older adults and people with disabilities remain independent and safe in their own homes, rather than face involuntary placements in nursing homes, which most people with disabilities would rather not be in a nursing home?
Right. I support all of those measures. Certainly we have a need for nursing homes, but it generally for people who are very elderly or their physical limitations are very high. So anything we can do to assist and help people live independently is a plus for them individually and as a society and as a community. So all the measures that you mentioned, accessibility and vouchers and providing renovations for buildings built before 1991 are all very sensible measures. And I think we would be doing our community, particularly our people with disabilities, a great disservice if we didn't take those measures to improve housing.
And I think the interpreters are switching.
Okay, thank you.
Thank you.
Excellent. Thank you for that question, Tori, and for such a complete answer. Our next question centers around transportation. A lot of people with disabilities really rely on transportation to get to work, school, medical appointments, and just to socialize and be active members of our communities. However, right now, regional transportation is really underfunded and often can't meet community needs. And so many regions aren't able to afford late night services or weekend services. This issue is really compounded for paratransit riders who face even more limited schedules. The RTA advancement bill would increase access to transportation by ensuring a baseline adequate funding for RTAs, dedicating half of Lyft and Uber's fees to funding RTAs, adding 2 seats for frequent riders to the RTA Council, supporting electrification of RTA buses, among other measures. And so what is your plan for increasing regional transportation in your district, particularly for people with disabilities?
Well, in considerable parts of Berkshire County and Franklin and Hampshire, and I'm sure Hamden, there's a lot of rural areas. And so the services might be subpar as far as the scheduling is concerned. I don't have a specific plan other than I know how difficult it can be in rural areas to get from point A to point B. If it's an issue of funding, then or more funding, then I certainly support it. I know there's been attempts. There's usually issues with there's different forms of transportation, but public buses. I believe they have the infrastructure on the bus to help with people with disabilities, but I think the biggest problem is the lack of efficiency with the schedule. So I think the only way you could increase the departure times and increase the schedule and make it more convenient is through more funding. So I support more funding. I wish I could elaborate on that, but
yeah, excellent. And that's really what advocates are pushing for is more funding of regional transportation because right now it's really underfunded and not meeting community needs completely. For our next question, I'll turn over to Tori.
Sure, thank you. I myself am a woman with a disability, and I am a parent of 3 young men. And this next question is about parents with disabilities. Parents with disabilities too often lose custody or parenting time due to their disabilities. Senate Bill 1083 would determine if a parent's disability causes actual harm to children using evidence. Explain in writing if a parent's disability is a negative factor in custody or parenting time decisions, and access if harm could be, and assess if harm could be avoided with adaptive equipment or support services for the parent. Currently, 1 in 10 children are at risk of being removed from their home because their parent has a disability. And while only 6% of the kids have a parent with a disability, 19% of the children in foster care have a parent with a disability. This bill would save the state money in imposed foster care placements and would prevent families from being separated on the basis of disability. Would you consider supporting this bill or another bill like it? What else would you do in the legislature to ensure that parents and children with disabilities receive the support that they need?
I would support it. I support parental rights, and we need to be extremely careful about the state taking custody away from the parents, particularly if it involves physical disability. If whatever measures need to be taken to help the parents on a day-to-day basis and to overcome those disabilities, we need to do that. Unless the issues involved or problems involved in the household involve an abusive parent, mental abuse, physical abuse, those are cases where I understand custody should be taken away from the parents, but it'd be so unfair to take away custody because a parent or both parents have physical disability. We need to help them, whether it's with increasing accessibility within the house, any type of assistance. It would have to be a very egregious or terrible living situation to take the kids away. And ordinarily, it's people who are underserved or underprivileged that have a higher likelihood of having the kids taken away because they can't afford to pay for the measures to provide the safest circumstances within the house for the kids and themselves. So it's unfair on a basis of income, and anyone that's underprivileged or underserved, they need help. So provided they are good parents and they're good to their kids, they shouldn't lose custody. Thank you.
Thank you. Unfortunately, parents with disabilities experience having their children taken away much more frequently than parents without disabilities. Thank you for your answer.
Thank you.
Thanks, Tori. And thank you for your question. Our next question is around digital equity. And this is something that I'm sure you. Oh,
I'm good.
Okay. So I'm sure that's something that you might have heard about already, being in a more rural county area. And so digital equity is the idea that everyone has the opportunity and capacity to participate fully in our society, participating in our economy, our democracy, education, through access to digital equipment and the internet. And people with mental and intellectual and developmental disabilities, as well as older adults, report that their biggest barrier to accessing the internet is a lack of digital literacy, meaning that they really need to learn how to use devices and the internet. People with physical disabilities report that their biggest barriers are lack of equipment and lack of connectivity. So living in a rural area, this could be an issue. How would you suggest that the legislature addresses barriers to internet access for these groups?
I know proper broadband has been an issue for a while. I was under the belief that, and there's always pockets they're going to be problematic. I know, I think it's the town of Worthington was one of the last towns that received better, quicker, more efficient broadband. So I'm not suggesting that the issue is done and over with. But as far as internet access, I was under the belief that pretty much all of Western Mass has the broadband and internet access. But as far as equipment and other access to computers and schools, most schools give out each student Chromebooks, Google Chromebooks, and I don't see any reason why we couldn't either in conjunction with school districts or independently provide computers and laptops or Chromebooks to people with disabilities. So I support any type of measure that would help people get access to that.
Awesome. Yeah. And so a lot of times people lack computers or don't know about certain programs like the Affordable Connectivity Program, which is a newer program that actually gives people $30 a month, which is typically the average cost of an internet bill. And so folks who are lower income can apply for that and get that. And advocates right now are working on expanding that sort of knowledge about that program, signing up for it, and things like that. I will, Tori, do you want to ask the next question or should I ask this one?
Sure, I'll read it.
Okay.
I'll ask it. Having reliable and affordable access to healthcare is extremely important, especially for people with disabilities. Currently, many family members of people over 55 on Mass Health are forced to pay back medical expenses to the state upon their family member's death or if they enter a nursing home. Essentially robbing families of people with disabilities from inheriting any wealth. The estate recovery bill would protect the families of people with disabilities and senior citizens who are on Mass Health, making it so that the state will only collect what is required federally and eliminate the estate recovery for those on Common Health completely. Would you consider supporting this bill? What are your other plans to expand access to healthcare for people with disabilities?
I would support that bill. The state's budget is $53 billion. It's 12 years ago, it was only 30 billion. So it has grown. And how we spend that money is where we have to focus. Whether or not we're spending it wisely, that's the big question. So I definitely think it's always a tough situation when someone passes or a situation where you have to pay back expenses to a state that, like I said, has a big budget. I think it's unfair for people who are struggling to get by to have to reimburse the state, particularly in a difficult situation, not only financially, but on a personal level with family members with disabilities. There was a second half to that question. I think additional legislation.
What are your other plans to expand access to healthcare for people with disabilities? Is that what you?
Right. Thank you.
You're welcome.
I'm not sure. I want everyone to have access to healthcare. As far as a specific plan, I'm not sure. I don't have one drafted, but certainly people are having more and more difficult time making ends meet. The cost of living keeps rising. Healthcare costs keep going up. So I can just say that I would support a bill similar to the one that you mentioned.
Okay. Because just on a personal note, I do have my 3 sons, and I want to be able to let them inherit our home. That would be what we could give them. And I have decided not to apply for Mass Health because I don't want them taking my house. I want to be able to, pass that on. So,
Yeah, and it's more. Oh, I'm sorry. I was going to
No,
say,
that's
yeah, it's bad enough. It's tough financially, but the memories that you have with a home, and to lose a home is personally would be so hurtful and so unnecessary, and just and costly on different levels. So nothing worse than someone being forced to lose a home.
And just keeping in mind with if someone's on Common Health, they're on Common Health because they are employed. They're a person with a disability who's employed, and so people who are on Common Health pay a premium, so they're already paying into the system. But as it stands right now, if they go into a nursing home or they pass away, Mass Health recovers the home in order to recoup the cost that for what that person cost them while they were on the Common Health or Mass Health. And that just that's not right.
And I just want to note that there's an interpreter switch. Sorry to interrupt.
Thank you for articulating that to me and providing that information and seeing your perspective on that.
You're welcome.
Thank you so much, Tori, for those great questions and for your own experiences.
You're welcome.
Our next questions revolve around direct care work and also nursing homes. And I'll ask first about direct care work. So currently there's a real dire shortage of direct care workers who assist people with disabilities with daily life activities like toileting, bathing, dressing, administering medication, etc. Personal care attendants are really important to allowing people with disabilities to live in their own homes and to live independently, as opposed to being improperly placed in a nursing home where most of us really don't want to be. Direct care workers within nursing homes are vital to also maintaining residents' qualities of life and health. And a lot of direct care workers are leaving their field because they get low wages, and there's a high cost of living right now. There's a lack of benefits, potential exposure to infectious diseases, high student loans, etc., and also limited training and educational opportunities. What would you do to possibly increase incentives to enter direct care work and to maintain direct care workers in the positions that they're in?
Well, there are staffing shortages, like you said, in nursing, at hospitals and nursing homes, and it's been a problem for a while. I know a lot of nurses leave the field, or they leave nursing homes or hospitals because they get burnt out. And part of that is because it is understaffed, so they have to do more work. Another reason they leave is their goal and expectations is to spend most of their time and resources helping the patients. And too often, there's a lot of course, you need compliance issues and there's protocol, but there's from people I've spoken to, including my wife, who's an RN, because she worked at a hospital and then with VNA, and the amount of paperwork, a lot of it was done on a computer, but still paperwork, and it was overwhelming. So I think if there's some way to yes, you need overhead, you need oversight and compliance and regulation, but if it entails too much paperwork and not enough time spending with the patients, they're going to increase the chances of nurses getting burnt out and not staying with their jobs. So that's a concern.
Yeah, absolutely. And it's really, it can be easy to put all of yourself into a job like that, and to also feel underappreciated, underpaid, and exhausted. And related to the issue of nursing homes and long-term care, we saw in the case of the Hoyoke Soldiers Home a lot of negligence in maintaining public health and safety, which really resulted in the serious illness and death. There were over 80 residents that died from COVID-19, and many more staff and residents became seriously ill with the virus. Advocates have been pushing for a change to long-term care away from large facilities, where many residents face neglect, abuse, sometimes, and indignity. During the 2021 to 22 session, there was a $200 million bond issued to actually undertake small house home constructions for veterans and local communities throughout the state. Would you consider encouraging the implementation of this project in the next year, because we really need to get going on reforming long-term care away from these huge facilities and towards smaller homes in communities where people can get the care that they need?
Right. I think it's a great idea because it'd be in a smaller environment, you're going to get better care, and I think probably the overhead and the cost will be less too. The initial cost of building buildings, putting them together will, and the initial costs will be substantial, but I think over the long run, having those smaller environments will cut costs. I imagine or hope be less overhead. I know in Pittsfield we have Soldier On, and it's individual housing. And I've heard a lot of great things about Soldier On, and I haven't seen the inside of the houses, but I've been to Soldier On. I've seen the houses from the outside, and it looks like they did a really great job. And that is the type of environment that I think anyone would gravitate towards, as opposed to being in a really large setting, which sometimes can be kind of depressing. And then also in Pittsfield, one of our nursing homes was cited, received several citations, and was fined for really terrible care during COVID. And there are separate incidents. So there's good ones, there's ones that aren't so good. Then there's the cases where the care is really terrible. So right in Pittsfield, one of our nursing homes was fined and cited and temporarily shut down by the state, and it's opened back up. So I'm aware of some of the more drastic situations.
Yeah, thanks for sharing that. And I'll definitely have to check out the Soldier On program. And great to hear that long-term care is being sort of rethought, and that you might be interested in also rethinking the model of long-term care. One of the most important bills that was considered by the legislature this year is an act to it's the long name is an act relative to nursing home quality and accountability, which would improve working conditions, standards of care, also strengthen protection of residents from abuse and neglect, increase training for workers. And as you've said, this issue is really being seen across the state. There are nursing homes all across the state that are just lacking in care and accountability and oversight. With that, I think we're almost out of time. And I want to make sure to leave enough time for questions from the audience. So if anyone does have a question, we would love to hear from you. No questions? Excellent. Oh, Ricky, go ahead.
Oh, sure.
Oh, should I grab a mic? I don't know.
Oh, yes.
I can hear you. I don't know about them.
Oh, there we go. So I represent the AdLib right there in Pittsfield.
Mhm.
And I was just wondering, with the homeless population there in Pittsfield, what are your thoughts on the shelters being overpopulated and short staffed, about alleviating some of that? What, like, do you have a plan to kind of take those stresses off, maybe building other facilities, lending your support to funding more facilities to help alleviate the homeless population there in Pittsfield?
Yeah, I believe the United Methodist Church on Penn Street is supposed to open up some housing for the homeless soon. I'm not sure when. And then the old St. Joseph's High School building, it was open for homeless people, and then it got closed down. I think it was ServiceNet was the organization that ran it. I'm not 100% sure, and I don't know why they closed it down. But if we can open up the rooms at the old St. Joseph's High School and follow through with the United Methodist Church on Fenn Street, and then I believe the Zionist Church, I might be getting the name wrong. It's a long name, but it's on First Street, and they're considering it's right near the Common, the First Street Commons. I heard that they're considering using a large part of their church for the homeless. So those three buildings would be really important. They're all centrally located. You could argue that they're too close together, but they are centrally located where a lot of the homeless people are. And so I would definitely support measures to bring that to fruition and make sure the old school and those two churches can convert their space to house the homeless, because it's definitely becoming more and more of a problem. So it's definitely something that has to be dealt with sooner rather than later.
Thank you.
You're welcome.
Yeah, thank you for that question, Ricky. I knew you would have a good question because because you work in the same district as Brendan would be representing. So thank you for that question. I think we have an interpreter switch. Awesome. And I also know that a lot of shelters tend to be inaccessible as well, or are not always up to guidelines, right?
Yeah, absolutely.
Barton's Crossing, there's a problem there. I think on Upper North Street near Zucchini's.
Oh, yeah,
Yeah, I heard the conditions there were
Yeah.
pretty bad.
absolutely.
Mm.
Yeah, definitely a lot of room for improvement, for sure.
Awesome. Yeah, well, thank you. Thank you for that question and that thought. We really appreciate that. Is there any other questions from the audience? And we might have time for one more. Awesome. Well, with that, Brendan, do you want to just quickly give any closing remarks?
Oh.
I put you on the spot there.
I know, without, giving myself selfish plugs here. I am on the ballot for the November 8th general election. I'm an unenrolled candidate. And I'm new to politics and decided to throw my hat in the ring and going to give it my best shot.
Yeah.
Thank you.
Want to make sure
Thank-
you think of us when that process is happening, because we really need your support.
I will.
Anybody whoever's elected, we definitely will continue our fight, but we'll stay strong, but we definitely need support.
Definitely.
Thank you.
Thank you so much.
Excellent. Well, thank you so much to Brendan for attending, to Iohann Rashi Vega for handling all of the sound and recording. Tori, thank you for being a panelist. And Nicole, of course, thank you for all of your help with this. We want to make sure that folks know to vote on November 8th. And if you have questions about voting or how to get an accessible electronic ballot, any questions about polling sites and accessibility, please contact me. My name is Brianna Zimmerman, and I am the systems change advocate here at Stavros. And I have a lot of information about accessibility that you might find useful. You can reach me at my email, bzimmerman@stavros.org. Thank you so much, everyone, for attending. And please go out and vote November 8th.
Thank you.
Thank you. And thank you to our interpreters.